Good afternoon, ladies and gentlemen. I, Dr. Suhail Ahmed, welcome you all in Faculty of Pharmacy, Mahsa University e-Talk series. We are privileged to have Dr. Ali Attiq with us, who is going to deliver a talk on lifestyle drugs and obesity. Dr. Ali is Head of Department of Scientific Basis of Therapeutics, Faculty of Pharmacy, Mahsa University. Dr. Ali earned his PhD in Pharmacy from University Kebangsaan Malaysia, UKI. His research work exhibited novel and significant insights on the genotoxic and mutagenic potential of drugs combination. He specialized in cell signaling pathways involved in inflammation and inflammation-derived mutagenesis, medicinal and bioorganic chemistry of marine and plant-based natural products. Please welcome Dr. Ali. Dr. Ali is all yours, sir. Please.
Thank you so much, Dr. Suhail, for giving me such an honor to be here first. Thank you for the Mahsa University for giving me this opportunity to express my feelings and to share my knowledge. But thank you so much one more time for a brilliant introduction. So let's move towards our topic then, lifestyle, drugs, and obesity. Obesity is one of the problems which you don't have to go anywhere. In the beginning, it was more of a lifestyle disease, but now the word epidemic is being used for particularly this condition. Now, the term epidemic is commonly used to describe rapidly increasing rate of any disease. Before embarking to my topic, I will like to share my contents of today's presentation with you. So, what is obesity? How can we say the person is obese? Now, the challenge is to use a better understanding and the regulation of the energy balance to develop strategies and to address this obesity epidemic. So, in short, what if we want to understand the obesity? It is a slight more weight than, not slight actually, it is more weight than we can say that the person is overweight. Means the person is going a bit more than tip of the mountain actually. So obesity arises as a consequence of how the body regulates the energy intake, energy expenditure, and energy storage. That brings me to my second slide over here and talking about the etiology. Now, likely there are a lot of factors which contribute towards the obesity. It can be genetic, means your parents are inheriting, you are being inherited to be obese, and you can blame your parents for that because it is genetic phenotypes have now been found out, and we can tell and we can say that this is actually in some of the population, we can say that the parents transfer this gene to their offsprings. Then the environmental and the physiological factors are also there. Now, environmental factors include like reduced physical activity. Now, nowadays, almost everyone is busy on the screen, either on the iPad, on their iPhones, or the gadgets they are carrying. It makes a lot of less room for us to go out and to have our daily activity. Even though if we want to do something which is very near and we can walk towards it, we prefer to take a car, a bike, or maybe a ride like something. Then the increased fat intake and the sugar at the same time plays an important role in the development of the obesity. Then decreased ingestion of the vegetables and the fruits, which are the important source of the fibers and helps keep our body in a lean body weight. So all these factors, along with the others, they play important role in increase body weight. Now, we cannot deny the fact that the genetic heritability accounts for 40 to 65% of the obese phenotype. So it means that majority of the people who are being suffered for the obesity or increased waistline, the parents are to be blamed, not us. Now, what are the contributing factors towards the obesity epidemic? We understand the physical factors, we understand the environmental factors, but what are the other factors which are responsible for doing so? Now, main reason, and I'm going to emphasize on obesity a lot, because most of the time what we understand is, and what has been delivered to us is, you eat more, you become fat. But at the same time, there are other things which not only entice us, but force us to eat more. Means, for example, advertising and marketing of the food, fast foods, especially targeted the children. And it has been seen in America and Canada that those children are the first customers, or they are the best customers for all those, what do you say, all those snacks, which plays an important role in increasing the body weight of our young children. Now, the other things which also play important role is, which we do not even realize, and we do not even understand that is actually playing a big role, is the serving size. Without even realizing, if and the study was actually being carried out, and the people choose the restaurant where the serving size was bigger or the larger than the other one. And that's why the humans, they always move towards something where there is extra or maybe something free. So the serving size is now increased based upon the demand of the customers, and they want to serve more. And based on that, the children are now obtained 50% more calories and added fats and sugar. Now, because of this reason, you in Canada, 60% of the population is actually prone towards the obesity. But not always the food is responsible, or overeating is responsible for such. There are other matters too which can play important role. Means the underlying diseases. Don't blame yourself all the time, because there might be an underlying disease which is causing that weight gain. And that is very, very important, because sometimes we keep on blaming ourselves, our relatives, our friends, our family, even, that they are gaining weight. And we do not understand what's the main reason, because we only understand this, that the eating more will lead to the obesity. But this is not true. There are other factors as well. There are diseases as well. And hence, because if there is an underlying disease which is causing to increase the body weight, such obesity is known as secondary obesity. Now, this one is the most difficult one to understand, and later I'll tell you it's difficult to treat as well, because in order to treat this kind of obesity, you need to treat the underlying disease first, and then we can move towards towards treating of the obesity, the treatment of the obesity itself. Now, all these diseases, Cushing syndrome, hypothyroidism, growth deficiency, growth hormone deficiency, insulinemia, polycystic ovary, all these diseases play important role in the development of obesity. Now, let's just take, because of the lack of time, we won't be able to discuss all of them, but let's talk about the polycystic ovary. Now, polycystic ovary syndrome, as the data suggest, it is one of the most prevalent reproductive disease in the female. And the data actually suggests that 5 to 10% of premenopausal women may pass through or may have or later in their life may present polycystic ovary syndrome. Now, it may be painful for some people, and it may cause different signs and symptoms, which includes acne, male pattern hair loss, elevated serum androgen. But we need to understand how it contributes towards the obesity. Now, Because of the polycystic ovary syndrome, increased androgen level is being seen in those patients, which stimulates the androgen biosynthesis in the ovary theca cells. Now, when that happens, it causes to suppress the sex hormone binding globulin production in the liver, and which counts for accumulation of fat in the body. This is just one incidence, and I have choose this one because usually women are blamed for being overweight. So if your weight is increasing exaggeratedly without any reason, and you know that you're not taking enough calories, then this could be one of the reasons, and this needs to be addressed as soon as possible, because later this can not only contribute to the higher body weight and obesity, it can contribute to the other complications as well. Now, if we talk about if we have talked about the feminine side, let's talk about the male side as well. Now, in the male, hypogonadism means your gonad cells. It means your testosterone are not being enough produced by your body, and when it's not being done, then you may face a lot of complications. One of them is means associated with the hypogonadism is that in the presence of the testosterone, the body inhibits the intake of the triglycerides. Now, when it inhibits that, it also promotes the lipid mobilization from the visceral fat. Means it protects your organs from getting fatty. In short, in easy words. Now, when a body is having lesser amount of the testosterone, so what will happen? The testosterone is inversely associated with the visceral fat mass, and which also does explain that why when we grow old and we are in the later stage of our life, there are more visceral fat than our body fat. So these two complications, one from the women's side and other from the male side, gives you quite an idea that it's not only the food intake which is actually causing this problem. Now, if we talk about a totally different scenario, for example, a person is going on the road, he has an accident, and because of that accident, the injury happens, a trauma happens, which causes a head injury, maybe. Okay, it's a scenario. A head injury occurs. Now, when that head injury occurs, that may lead to the hypothalamic obesity. Now, hypothalamic obesity means what I'm trying to make a sense over here is, okay, we understand that there is a problem with the ovary in the female. Then second thing is there is a deficiency of a testosterone in a male, but this one is totally accidental. This has nothing to do with any metabolic disorder or the deficiency or excessiveness of any hormone. This is by chance, maybe by tumor, my inflammation, or even a fall or a surgery or a trauma can lead to hypothalamic obesity. Now, how does it happen? Now, now in this one, now the main part means when there is an injury, the ventrometrial hypothalamic nucleus gets injured. Now, when this gets injured, this causes a series of symptoms to be produced. For example, hyperphagia, decreased metabolic rate, autonomic imbalance, growth hormone inefficiency, and all of which contribute towards the obesity. Now, I guess I have presented my case well for the secondary cause of the obesity, that it is not only because of excessive eating or having high calorie diet. There are diseases which contribute towards the obesity. And I was going to say that in the conclusion. So but I will say that over here as well. So if your body weight is increasing exaggeratedly, and you feel that you're not having enough, your diet is controlled, then you should consult someone who can help you out, and definitely that would be a physician, to find out if there is any secondary reason, or is it a secondary underlying disease which is causing you to put on the weight. Now, when a person is obese, there are lots of complications and the challenges the person has to face. The first and the foremost, of course, the most common ones are the cardiovascular complications, means hypertension. High blood pressure is directly related to your body weight. According to research, 1 kg decrease in your body weight may lead to 2 to 3 mmHg decrease in your blood pressure. And if you ask me, this is one of the best medication that you can give to you by reducing the body weight. All right. And which is leading to the hypertension. Atherosclerosis means the occlusion of your blood vessels. Then diabetes is cause and effect of obesity at the same time, means it can induce, and then that obesity can cause the diabetes as well. Vascular inflammation and arthritis and all the diseases related to, means you're putting more weight on your you're putting more and more weight on your legs and your joints. So of course inflammatory process is inevitable. So it is not only causing direct physical effects, but also by looking at the diabetes, it produces metabolic side effects to your body as well. Now, what are the socio-economic burden? Means I have started my conversation by saying that it's an epidemic. So if it is an epidemic, so it's not a small population which is getting affected. Now, of course, it produces harm, and it make challenges to a daily lifestyle, to a daily life of a person who is obese, right? But at the same time, at a larger picture, at a larger canvas, you can see it affects not only a country, but the whole human race as well, because it is kind of a threat towards the human race, because right now our human body does not know what to do and how to deal with the excess amount of this all calories that we take. All right, so because of that, socio-economic burdens are imposed by the obesity, not on the healthcare system of any specific country, but as globally as well. The data states and data suggest, the study shows that the obesity rate increases from 5.6% in 1985 to 14.8% in 1998, and this is expected to go higher. There is no turning back. The prevalence, I'm just reading the stats over here to make us understand that how serious this problem has become. The prevalence of the overweight children has more than doubled, increasing in girls by 57% and boys by 92%. That's a lot, if you ask me. I mean, being a pharmacologist, when I see this kind of statistics, I am really worried about our children and our new generation. Then this is just the stats that how many people are being entered into the circle of obesity every year. But let's talk about the economic burden to the healthcare system. Now, direct cost of the obesity in a survey which was carried out in Canada, and that research actually told us that $1.6 billion were the direct burden in 2009, and the indirect cost was 2.7 billion in the Canada when we talk about indirect effects of the obesity. Now, this is quite a lot of money, and that money can be used for the development in other can be used for other development purposes as well, for the infrastructure, for the betterment of the healthcare system. But we are spending this money for the treatment of obesity and the complications that are associated, that has been associated and created by the obesity as well. Now, of course, if there is a problem, there has to be solution. Okay, and the science has provided few interventions through which we can reverse this process and can enter into the realm where we can enjoy our life without being obese. So there are, in pharmacology, since that's my forte. In pharmacology, we divide all the interventions against any disease into two main sections. Number one are non-pharmacological, in which we do not use any drug. I'm going to concentrate that a lot. I know you must be thinking he's a pharmacologist, he should talk about drugs. But being a pharmacologist, I also know that all these drugs which I teach and which the doctors prescribe, they have a lot of side effects. So prevention is always better than cure. And with that, let's move towards our non-pharmacological interventions. The first one would be the diet. And there is no other better way of saying this, that diet is the best and the only way to reduce weight, because your dietary intake and the consumption of energy is actually plays the main role between being a smart and sleek person and an obese person. So in the diet, what is the best diet? The greens. I know most of people over here must be thinking that everybody says eat greens. Even our parents in our childhood said they eat greens, but they said it based upon a very important fact that all the green vegetables have high fiber. And this high fiber helps and keeps our body toned, whereas it also allows our body to keep our digestive system intact, which is very important when it comes to control the obesity. Then the physical activity. The physical activity is very, very important, because whatever you eat, if you consume that energy, then of course the body does not have to produce any extra effort to store the food that we have eaten. So at least the research says 3 times a week, if you are exercising 3 times a week for at least 30 to 45 minutes, then you can consider yourself as an active person. And that may contribute towards decreasing your waistline as well. But at the same time, the diet is an important factor. You keep on doing the physical activity, but on the other side, if your diet is not controlled, the results are not going to be ideal. Now, in the physical activity, it should be in such a way that your heartbeat or your heart rate remains higher than 100 beats per minute. But I would seriously recommend all of you, this is a journal guideline which actually states that if keeping your heart rate up to this minute, if up to this time can help in decreasing the waistline, in decreasing the body weight. But at the same time, I would recommend that if a person had a cardiovascular disease or any metabolic disorder, they should consider contacting their physician first, because in this scenario you should take advice from your physician, because the people with the heart diseases are more prone towards particularly hypertension, are more prone towards having the congestive heart failure. And if excessive physical activity is done, then the higher incidence are there for the such. Now, third thing which we are going to talk about, and which is one of the important factors when we are trying to make an intervention against the obesity, is the behavioral therapy. which is also known as BT. Now, recently, it has been said that behavioral therapy plays very important role, and if this therapy and small things is being carried out in a nicer way, then you will be able to get the ideal results within no time. Now, medical nutrition therapy for the weight loss should last for at least 6 months. Okay, means one you cannot have a cheat period or cheat day, and you cannot eat whatever you want. And I'm going to say this once and for all: for 6 months, you have to keep your diet restricted for at least 6 months so you can get the ideal results. Now, reduce body weight to an optimum rate of 0.5 to 1 kg per week in the first 6 months is very important. Means you control your diet. Number one, take more fibers, less calorie diet, less fat, less carbohydrates, of course, and then you will be, and with the physical activity, you will be able to achieve 0.5 to 1 kg per week, which is around 2.2 pounds a week. It's not bad at all, just by taking interventions which are in your hand. Now, let's talk about the behavioral therapies. So in the behavioral therapy, self-monitoring really helps in reducing the in the treatment of obesity. Now, all these things can be either done by you, or it can be done by your partner, your brother, and they can really help you out. And that is actually one of the part of the behavioral therapy as well. Later, we are going to discuss that. Now, self-monitoring, how does that help? Now, self-monitoring allows you to record your food intake. How much calories have you used? How much calories have you consumed? What have you ate? How many times have you ate? Okay, all those things really help you out in getting a proper plan. And even in the placebo versus pharmaceutical agent trials, this has shown that who successfully maintained their record of food intake lost twice as much weight compared to those who did not. So the science is actually supporting this activity, that you should keep all those your dietary activity in a form of a diary, so you can control and self-monitor yourself. That's one thing. Now, moving towards the stimulus control. I know you must be thinking when you are at home and you're not doing anything, the first and the foremost thing you would do to kill your boredom is to eat. But in order to avoid that, you can. Everybody is a food lover. I am a food lover. Some of the people, they cannot live without food. So there are other ways to actually cater this problem if you are a food lover. Now, reducing the plate size or the container, or this really helps this really helps the person to actually keep a control on its diet. Then the items of the food are very, very important. What are you selecting? What grocery are you doing? Whether it has more fruits or more sugars? Are you taking more fibers than versus more fats? So all these things, they really help you out. And one more thing which I want to add over here: while you guys eat, please do not use the screen, because a new relatively a recent research has also stated that concentrating on eating without being distracted by the television and the reading material make you feel more satiating, while using the screen and eating makes your appetite grow. And even though you had your portion, you won't feel that you are satiated. Now, this is the second thing, the intervention, non-pharmacological intervention that you can take in order to beat your obesity. Then behavior contracting. Now, over here, now this is interesting as well. Now, Now, over here, uh, um, the incentives, for example, if I lose this much weight, then I will do this. Or your partner, your brother, your parents, they can bribe you to lose weight. And the studies have told that it really works. Means in a 16-way randomized controlled trial, 57 predominant male subject, the financial inducement led to the average loss of 6 kgs as compared to the control group, which lost only 1.77 kgs. So bribing your partner to lose weight really helps you out, and not just 10. It's quite a lot of weight if you ask me, 6 kgs. So this is one of the way to produce motivation towards your brother, towards your partner, towards your family member and your friends. Now, slow eating. Now, this almost in every culture, it is like that you should not eat fast. Okay. Now, when I went through and through the literature, I came to know that the people who eat slow, they receive more signals, and more amount of leptin is released, which gives you a feeling of fullness, because our body understands and communicates with each other with the help of few chemicals, proteins, hormones. And when you eat fast, the body does not have the time to react to it. Now, these kind of techniques means eating slow, includes concentrating on the taste. I know you must be thinking that it would take a lot of time, but at the same time, there is a positive side to that, and that is you can enjoy the food. As simple as that. Now, which includes concentrating on the taste, pausing in between the meals, drinking water in between, not so much, but drinking water in the meal. All these really helps you in feeling and really gives you a feeling of fullness. And when that happens, you will take lesser intake of the food, and eventually, indirectly, that will lead to that will be one of the major interventions. I have tried it; it really works. I guess you should try as well. Now, goal setting. Goal setting is very, very important. What I want to achieve, break it down into sections in a week, in a month, in days as well. What do you want to achieve? But I would really suggest that you keep it to the weeks and the months, because sometimes when you put a lot of effort in reducing your weight and you're not able to see that in front of you, then you might get disappointed and you leave your practices. So keep that up to weeks or to the months, that I want to reduce 4 kgs or 5 kgs or whatever your goal is. I will lose it in 1 month and then achieve it. Now, when you achieve it, setting realistic goals for the patients intending to lose weight will really help you to actually to do this process step by step. Now, increasing physical activity would be, of course, the first and not the first and the foremost, but one of the most important, along with all those things that I have just said. Increased physical activity would be on the emphasis. Now, increasing physical activity is another important component for the successful behavior therapy package. Now, repeated studies have shown that self-monitoring and increased physical activity constantly associated with the better outcomes. And physical activity not only helps in the obesity, but also in the hypertension, also in the diabetes, and other metabolic or cardiovascular disorders as well. So when you do the when you increase the physical activity, you're not only toning or decreasing the fat content in your body, you are actually giving a treat to all the organs in your body by supplying more and more oxygen towards them. So as so I would really suggest that you should do physical activity. As it's really not necessary if you're not. I know nowadays the the work, the intensity of work is so much that we are stick towards the screen, either to our phones or either to our iPads. But the physical activity will really give you a reward, not today, if not today, later in your life, when you are later in your age. This will really help you out. Now, social support. It has been actually seen, and the studies have suggested that when your partner, your brother, your parents, or your friends and family, and anyone from them support you or even practices these activities with you, it has been seen, then it has been seen that the patients with which partners support them, the better results has been observed. For example, a recent meta-analysis have conducted that including the family members led to the additional 3 kg weight loss compared to the programs that does not include the family members. So based upon this study, I would really suggest you should ask your parents or your brothers and sisters to do all the exercise and everything which I have done, I have said to be done with you. I know they will feel the pain and they will be uncomfortable in the beginning, but they will thank you. Trust me. Now, when all these things are done and they are aligned in such a way that your diet is okay, your physical activity is fine, and all the behavioral therapy that we have studied over here, and with that we can use and we have to use sometimes the pharmacological interventions as well, means the use of the drugs. Now, these use of the drugs, the use of the drugs are important, especially in the obesity-related symptoms, which, if they start to appear, and even they are not there, the cardiovascular or cardiometabolic risks are there. So in order to avoid that, we may move or we can move to the pharmacological interventions as well. Now, same goes for the overweight or the obese patient with the type 2 diabetes in order to improve their glycemic control. So in these, I have just mentioned these two over here, but other than that, there are other diseases as well which demands the pharmacological interventions. So what are they? They are now there are quite a lot of medication, but I have used I'll be using over here, and I'll be discussing over here only two. The one is phentermine, is used for the short-term management of the obesity, where the Olstrap is used for a longer duration and can be used for a longer treatment of the obesity. Now, phentermine it behaves it is actually a central nervous system stimulant. Okay, it stimulates your central nervous system, which eventually leads to loss of the appetite. Now, it was used previously as one of the mainstay medication for the treatment of the obesity, but now we try to avoid it mainly because of its side effects, which includes heart rate, increase in the heart rate, increase in blood pressure, insomnia, arrhythmias, cardiovascular diseases, stroke, and the heart failure. And this mainly because it increases your sympathetic activity, means it artificially creates an environment of flight and fright in your body. Now, when that happens, your body does face the complication. The main mechanism of action of this drug is to suppress the appetite. But of course, as I have told you in the beginning, the pharmacological interventions always come with a risk factor. And here are few of them that we have discussed. Now, for the long-term treatment, we may use the Olstrap, which is a lipase inhibitor. Now, in our body, what happens actually? Whenever we take the food, for example, I'll take the example of nasi goreng ayam, because which includes the fried chicken as well. Now, our body does not understand that what we have eaten. Either it is rice, it is chicken, or is it curry. Means our body only understands the language of carbohydrate, proteins, and the lipids. So whatever we eat for our body, it is carbohydrate, proteins, and lipids. So what happens when we take the Olstrat? This prevents the absorption of the fats by inhibiting the pancreatic lipases and the gastric and pancreatic lipases. Now, this enzyme is actually responsible for converting the fats in your food into small molecules or lobules, which facilitates the absorption from our gastrointestinal tract. Now, when this happens, this eventually leads to the prevention of the absorption. This leads to prevent the absorption of our fats from our gut, and lesser fat will be absorbed and will become part of our body. Now, this can be used thrice a day, means in the morning, in the evening, and in the night with the breakfast, lunch, and the dinner. And it really helps in reducing the absorption up to 35%. Well, the patient who been using this medication for over a year, a significant weight reduction along with the dietary modification, the significant results has been observed for the patients who are using Olstrat in comparison to the patients who are not taking any pharmacological intervention. But of course, it is associated with side effects as well. The lipid-soluble drugs, lipid-soluble vitamins, for example, vitamins have lesser absorption as well. So the patients are advised to take multivitamin supplements that contains vitamin A, D, E, K, and beta-carotene as well. Now, if you ask me about my expert opinion, then it would be this, and I will try to make it as simple as possible. Obesity is a multifactional disease demanding multidisciplinary management. Means if we cannot talk about obesity and we just concentrate on medicine, or we can concentrate on the physical activity, it's a problem which needs to be dealt with all sides. Okay, and few of them we have discussed over here. Then energy restricted diet and regular physical activity is the only way to treat your obesity or bring your waistline or your body weight down. And I'm sorry to say this, there is no other way or magic pill that can reduce your body weight than these two effective methods. You have to control your diet, and you have to have regular physical activity as well. Now, with that, like I have told you, up to 60% of your parent genetics plays an important role. So possibly pharmacogenetics will be helpful, at least in some genetically prone obese individuals. So this is one of the factors which, in my opinion, is very important if the person is obese and you are taking interventions for decreasing the body weight. Now, discovery of the new pharmacological alternatives is also an option, and the process is undergo. It's going on slowly, and eventually it is going on, and new drugs are coming in the market, which can be more effective, and the treatment of the obesity becomes more safe, and whereas the side effects are the minimum. Like, all new anti-obesity agents ideally must not only reduce the fat mass but also correct the fat dysfunction, which is adipopathy, and consequently abnormal glucose metabolism, dyslipidemia, and hypertension, and silent inflammation are all associated with it. Those new drugs, which I believe it should not only treat the obesity, but it should also treat the cause and the effects generated by the obesity as well. Last but not least, Canada has used this method, and I would really suggest that other countries can do the same. Taxation. I know it sounds kind of abnormal that how come the taxation comes in the obesity? But the Canada has applied special taxes on the food which has high content of sugar, high content of fat, trans fat, and all those high calorie diet, which can add more and more pounds to your body weight, or can increase the circumference of your belly. Now, how that really helps? First of all, these diets become out of the range of the children. I know it's not a good strategy, but at the same time, the amount of money that has been generated in 2019 from this taxation was used in 2011 and 12 for the betterment of their healthcare system. So Canada has found out a way of making money from the taxation and then using it in a betterment of the obesity or the obesity related diseases or the complications and the socio-economic burden imposed by the obesity itself. Now, with this, I want to conclude my conversation, and I would conclude it. By these points. Now, addressing the obesity epidemic and individual weight management is going to require closer link between the intake and the expenditure side of the energy equation. And the involvement of physical exercise advice is certainly an important consideration besides dietary recommendation. Now, many overweight and obese individuals have tried to lose weight with the lifestyle interventions, and most of them has been successful to some degree. However, few succeed in a long-term maintenance of the body weight. Now, obesity has been described as the greatest current threat to the human being, or the human species would be the most appropriate word to use over here, because today we have understood that obesity is not a disease, but it is the reason for actually giving birth to the other diseases as well. Now, this is the time, and this is the initiative to reduce your body weight by taking all the interventions and all the behavioral necessities that we have discussed today. It was just an effort to give you more information on the obesity and the drugs which are used for its treatment, and at the same time the non-pharmacological interventions which are as appropriate and effective as that of the pharmacological management or pharmacological interventions as well. With this, I like to conclude my session for today, and these are the references from where I have shared all this information for you today. Thank you so much, and thank you. Have a nice day.
Thank you very much, Dr. Ali, for the amazing, comprehensive presentation. Well, I must say your today's presentation offered good food for thoughts for everyone, especially in the context of work from home because of COVID-19 that resulted into limited physical activities and job-related stress. With that, I will open the floor for the question and answer session. As we don't have the question at the moment, let me start the question and answer. Dr. Ali, as you know, in Malaysia, the prevalence of overweight as well as the obese population is on the rise. In your opinion, what are the underlying reasons contributing to this increase in obese population in Malaysian context?
It's a very relevant question, Dr. Sohail. Thank you for asking. day before yesterday, while I was driving to home, I was listening to the radio, and it was a fortunate for me because I listened to the same answer to your question, but it was a very unfortunate that I came to know that 1 out of 3 people in Malaysia is obese, means 2 out of 3 people in the Malaysia is going to be obese in next country. If you have asked me, then of course the role because children and generation. Now, if we restrict 2 things, okay, it's a two-step thing. Number one, we restrict their calorie intake and we increase their physical activity. That's number one. And we also have to restrict their screen time as well, so that they can use that energy, go out, exert some calories, and reduce some circumference around their belly. So, if you ask me, and in the US itself, it is also said that the use of these and the increased screen time has actually not one of the major factors contributing towards the obesity, but it is also the factor towards the cardiovascular or metabolic disorders as well, because it aggravates obesity, it promotes the sedentary lifestyle, and we all know the sedentary lifestyle is a one-way road where the end of it you'll meet a lot of diseases. So increased physical activity, lesser calorie count, and lesser screen time can really contribute towards the better results.
All right. Thank you very much, Dr. Ali. We have one more question from Mr. Apala Raju. So his question is how hypothyroidism will increase the obesity.
So hypothyroidism is actually in which your body is not able to produce enough amount of this is where it's a metabolic disorder in which your body is having lesser amount of thyroid activity. Now our thyroid gland is responsible for controlling the metabolism. Means if you eat, if whatever you are eating, it will convert that into different parts of our body. For example, proteins, the building block, which are important building blocks of our body. Then it will also control the metabolism associated in our body as well. Now, when during the event of hypothyroidism, the body intake, the energy intake is same, but body is not using that energy at all for any purposes. Or even if it is being used, the amount of concentration, which means the balance, the intake and the exhaustion of those calories are not balanced, and that's why it contributes greatly towards the increase in the body weight. But it is not as marked as the other diseases that I have told before. And looking at the prevalence of the hypothyroidism, I still remember the stats. It is quite low. Means in male there is only 1% out of thousand people. In the female there are 4 to 5 people, females out of thousand population have this condition. So of course, the people who are suffering from this, they will have to face the complication of the obesity as well. But for the other people who do not have this complication, they have to control their diet, and there's no other way.
All right. Thank you very much.
Thank you, sir.
As we have no more questions, we will conclude our today's session. Please stay tuned to Mahasa University webpage for more updates and webinar lectures. With that, thank you very much. Thank you very much, Dr. Ali, and thank you very much to all the
Thank you, sir.
viewers.
Thank you so much, sir. Thank you.